Hi, my name is Amy Blackwell, and this is my final presentation. I decided to do it on, is HIV positive the same as AIDS? The answer to that question is no. There is some relation, but it is not the same. HIV, also known as the human immunodeficiency virus, is a lot like other viruses, including those that cause the flu or the common cold. But there's an important difference because over time, your immune system can clear most viruses out of your body. But with HIV, the human immune system cannot seem to get rid of it. Scientists are unfortunately still trying to figure that out. We know that HIV can hide for long periods of time in the cells of your body, then it attacks a key part of the immune system, your T cells or your CD4 cells. Your body has to have these cells to fight infections and disease, but HIV invades them and uses them and makes copies of itself and then destroys them. Over time, HIV can destroy so many of your CD4 cells that your body can't fight infections and disease anymore. When that happens, HIV infection can lead to AIDS. Acquired immune deficiency syndrome is the final stage of HIV infection. People at this stage of HIV disease has hardly damaged immune systems, which put them to risk of the opportunist infections. This is just a few things that I'm going to go over with in general about AIDS and HIV and their relationships. As you can see, we're going to go over some medical terminology, some reasons, some charting, and a couple pictures, medications that are associated with the virus, evidence that the HIV is linked to AIDS, unfortunately. Some organizations, nonprofit organizations that people can get in touch with if they do encounter this virus, simple websites and links. And at the end there is a short YouTube video that gives a lot of valid information if someone's really interested into the virus. The beginning of what we know as AIDS. It all started in the large countries we know in Africa. The location was West Central Africa and the Congo to be exact. In 1959, the first death of the HIV patient died in the Congo. Things went on, years passed. By the summer of 1981, the first 2 AIDS patients had arrived in the NIH research hospital 6 months apart from each other. Now, I know back when I started, I was born in 1979, and, when I talked to my mom and dad about this, you would hear about, young men were dying of serious but rare infections due to damaged immune systems. They didn't know what was going on. They had no idea of the cause. But later in research, a very, very important Dr. Anthony Fauci started it, as he would say, it was like living in an intensive care unit all day long, because this disease was so bad and controlling people's lives. Possible culprits. Well, we all thought it was first the African chimpanzees because, over there they were having it from them. Gay, homosexual men, needle transfers, bathhouses, unprotected sexual intercourse, pneumonia, blood transfusions. There was a wide range of things that people thought of where AIDS came from and whatnot. Medical terminology. HIV. Human immunodeficiency virus is HIV. AIDS, acquired immunodeficiency syndrome. Also, you're going to see that there's differences in the terminology and how you can acquire these viruses. With HIV, this particular virus can only infect human beings. It cannot infect anything else but humans. HIV weakens the immune system by destroying important cells to fight off disease and infection. A virus can only reproduce itself by taking over a cell in the body of its host. Now, if you look over at AIDS is a little bit different. You can acquire AIDS after birth. Your body's immune systems include all the organs and the cells that work to fight off infections or disease. You can get AIDS when your immune system is deficient or isn't working properly. And it is a syndrome, is a collection of symptoms and signs of a disease. So one is a virus and one is a syndrome. Don't put that together. Here's just some charts that I found online that I thought were pretty cool because it kind of explains to you exactly where things that happen and where it affects your body parts when you have these viruses. And they're very specific, and it's very different. So if you want to look over that. Stages of HIV. There's actually 3 different stages. One, as you see, stage 1, the acute infection. As you see, during this time, large amounts of the virus are being produced in your body. During stage 1, most people do not know they even have the virus. Sometimes they get flu, they feel like they're sick, something just isn't right, but they don't know, but they would never guess they had HIV. Stage 2, clinical latency. HIV reproduces at a very, very low levels, but is still active, but it's very low. That's why it says it takes 10 years for this virus to actually be diagnosed in someone's system, or for them to see it in blood tests. Stage 3, as your CD4 cells fall below 200 cells MMS, you will be diagnosed as having AIDS. Again, stage 3 takes a long period of time, but unfortunately, it will get to that. It plays a hard effect on the body, as you can see how it destroys people's faces and deteriorates everything. It's sad, because what it does to the body itself. Some of the medications that these people are introduced with and have to take on a daily basis to keep the virus maintained or not being transferable. One of the top rated medications is Atripla. This is a very well-known drug. This is on the top of the line and top of the shelf is what most people take. There's Comprella, and then there's Stribidol. I did a lot of research, and like I said, these are the 3 on the top that most of them take. As you can see, Atripla is a multi-class combination drug. They have to take this every day, twice a day, for the rest of their life to maintain the drug. HIV linked to AIDS. This is kind of interesting because how they figured this out and how scientists came to about with the populations and everything. HIV and AIDS have been linked together over time in populations. HIV is found in the blood of AIDS cases in every country and region where AIDS cases are documented. People such as homosexual men and women, drug user, heterosexuals, infants, and blood transfusion patients have one common factor that links them to AIDS, and that is being infected with HIV. Scientists can now use a method called PCR to find HIV in virtually every patient diagnosed with AIDS. They also can collaborate the amount of HIV found in the body and progression of the immunological process seen in people with AIDS. So they have come a long way with the research and linking these 2 viruses. I'm not saying they are the same, but there is a link in them and how people are found with this virus. Non-profit organizations. There's a lot of organizations out there to help people with understanding the virus, helping them research it and help them understand it and get help with it in general. I went through a lot and I found the 3 of the top ones. AIDS Medicine and Miracles is a really strong organization, and they help people really get through it and understand it. I mean, your whole emotional side is controllable. Messenger Foundation for AIDS Research. They do a lot of research about HIV virus and understanding it, and they are trying to find a cure themselves. AIDS Authority is more for the people that having with cultural issues and people living in different cultures and rural areas, and they'll help you get through it and find you help in general. Websites and links. These are somewhat good websites if you really want to find out some true facts and information about AIDS and HIV. Really a good one out of all of them is AIDS.gov. There's a lot of information there, that things you probably would never guess about AIDS or HIV found, or just some of the research that is just scary information. But it's good information if you really want to know about the viruses and how to protect yourself against it. and whatnot. I found this video on YouTube, and it is a very strong video. It's 3 minutes and 52 seconds long, and it is about a doctor telling you exactly how you get the virus and how to take care of it, how to maintain it, how to stay away from people, what you can and can't do, what's true, what's not true. It is very factual, and it tells a lot of people a lot of things. So if someone wants to view it, they're more than likely to. You just need to have the Adobe Reader to view it, or you can go to YouTube and it'll pull up. So, well, this is the end of my presentation. I'm hoping that you guys have learned a lot about AIDS and HIV, and also understand that they are not linked together. They are linked together, they're not the same. Someone with HIV is not necessarily going to get AIDS. Maybe down the road they might, depending on how they take care of the HIV, but it is not the same. So please do not think that I'm telling you it's the same, because it's not. This is my worksite page, thing where I got a lot of my information. Everybody's welcome to go to the websites and look. And like I said, it's very factual, very interesting information. So, alrighty, well, I hope everything is nonchalant and everybody gets along and we're good.